Studies show that any time before the age of 60, when we're looking at benefit and outcomes, that's typically when we want women to consider hormone therapy.
This week, we are talking menopause. There are a lot of new studies and information to share. For so long, hormone replacement therapy had this stigma and was considered risky because it caused breast cancer. Well, I talked with Dr. Jessica Shepard, who you just heard from there. She's a gynecologist and author of Generation M, Living Well in Perimenopause and Menopause. And she explained that new data show there is not a significant increase in breast cancer cases, and the often referenced study from some 20-odd years ago was misrepresented and misaligned with what the study was actually looking at. In fact, she explained studies are now looking at the benefits of hormone replacement therapy outside of relieving menopause and perimenopause symptoms.
Now, what we have seen in the study is now looking at how it can decrease potential, diseases in the future, such as cardiovascular risk, when we're looking at probable impact on dementia, and then also with osteoporosis. So those are three things that women can consider later on in life.
Well, the idea is that estrogen loss is a risk factor for heart disease and dementia. So researchers want to know if replacing that loss with HRT reduces the risk for future diseases. Now, I covered the link between menopause and those issues yesterday morning. You can find that story on our website, WJLA.com. And tomorrow, I'm talking about perimenopause, the many years leading up to menopause, and what role HRT plays in that time frame.